Welcome to this episode of Disease du Jour, where we're going to do a preview of topics of interest from the 2020 AAEP Virtual Convention with the Technical Services Veterinarian team at Merck Animal Health. Merck Animal Health is the 2020 sponsor of this podcast, and we are pleased to announce that Merck will be joining us again in 2021 as the sponsor of Disease du Jour podcast. Before we begin, here's a brief outline of what the 2020 AAEP Virtual Convention will offer. Beginning on Tuesday, December the 1st, you'll have access to on-demand sessions. From Tuesday, December 1st through Friday, December 18th, there will be live table topics via Zoom, 2 per day. From Saturday, December 5th through Wednesday, December 9th, AAEP will have its convention prime time. This will feature sessions such as the Kester News Hour and the Milne State of the Art Lecture. Trade show hours for exhibitor chats and product demonstrations will take place during prime time, as well as social events in the student program. The AAEP wanted to make sure everyone knows that although selected educational sessions will be presented live during the convention prime time, those and all other educational sessions will be available for viewing on demand until June 30th, 2021, enabling you to watch sessions when it's most convenient for you. And to give you some tips on sessions, topics, and presenters that you don't want to miss are our guests for today's Disease du Jour podcast, Dr. Fairfield Bain, Dr. Earl Gahn, Dr. Bryant Craig, Dr. Dwayne Chappell, Dr. Christie Schneider, and Dr. Craig Barnett. Since many veterinarians who attend live conventions love the hallway chats they have, we wanted to bring you a taste of that in this episode. So we're going to hear from each of these veterinarians about topics and presenters they're excited to see and hear at this year's virtual AAEP convention. And as a bonus, on December the 31st, after the live portion of the convention is over, we will reconvene with this group to hear what their takeaways were from the convention presentations they attended. So if you can't attend all of these presentations, make sure to catch the Disease du Jour podcast on December 31st for their takeaways. So we're going to start with Dr. Fairfield Bain. Dr. Bain, what are your top picks to attend at this 2020 AAEP Virtual Convention and why?
All righty. Well, hello, everybody. I just thought I'd list a few of the ones that really stood out to me. And starting off is speeding performance horses with myopathies. And I think we all recognize that a variety of muscle disorders in a performance horse are incredibly common in practice. And so how to manage them is every bit as important as we could prepare ourselves, and that includes nutritionally managing them. And Dr. Joe Pagan is one of probably our better known nutritionists in the business, and I think he is going to be prepared to, give you a ride through the energetic metabolism as far as muscle disorders and how we can approach those maybe in a preventative fashion from the nutritional management. So I really look forward to seeing what Joe has to say. The next one up on my list, I think, is also really important, is how to interpret history and physical exam findings of a horse with acute abdomen by Dr. Louise Southwood at University of Pennsylvania. And with all the diagnostics that we hear about this day and age, I think it's never more important to remember that the basics, the art of medicine, are the history and the physical exam. So when you have an expert like Dr. Southwood, that's going to go over that, I think that's something to really pay attention to, and therein lies our real value as equine veterinarians. And right behind that, I put how to perform a diagnostic flash, or the abdominal ultrasound examination by Chris Novice, also at the University of Pennsylvania. And Chris is an incredibly good sonographer, and I feel pretty confident he's going to deliver a presentation that is going to get you comfortable going through the abdomen of a horse. And even somebody who has not a lot of ultrasound experience will probably come away from that feeling like, hey, I can do this. And so that's one that I look forward to watching. And then my brother from another, Dr. Nathan Slovis at Hagyard, is going to talk about diarrhea in the neonate, and is there anything new? And, that's the question, is diagnostically, finding out the real answer is sort of a challenge in our world. And I'm sure that a lot of people in the audience will have had this problem, and you may come up with what you think is the diagnosis. And maybe we're running down the wrong path. And so I think Nathan is going to guide us through a lot of the newer techniques, especially molecular technologies that are going to help us pick, what's going on. And then the next step is therapeutically how to manage those. So I suspect Nathan is going to come, with a really nice presentation about that whole flow, and help us out in that direction of neonatal diarrheas. And then kind of the last one I picked was computed tomographic assessment of brain damage by various firearms to determine euthanasia efficacy of horses by Dr. Lund. And I picked this one. It's a topic that's very serious for us as equine practitioners. I always thought if you're going to be good at something, be good at euthanasia. And it sounds contrary to most of the ways we practice medicine, but I feel like really confident that pretty much everybody in the audience is going to want to learn about this. I think the challenge that we think of using firearms in practice these days is that perhaps it's not as socially or politically acceptable in a lot of people's minds. It's been proven to be one of the most effective forms of euthanasia. And having served in the past on the ABMA panel on euthanasia, I feel pretty strongly about that. And so it is something that I would encourage practitioners to understand and be familiar with. And if you're not familiar with firearms, I think this presentation is probably going to give you some in-depth information, because we really have not had a lot of basic science applied to this technique, really. And so I think they're going to show you how to choose what type of firearm, and what the changes might happen in the brain. They're using CT imaging to assess that and give you some kind of guidance. And so I would encourage everybody to pay attention to this. It might not be high on your list because you might not know what kind of information they're going to present to you, but I can tell you I'm pretty sure that's going to be very valuable. And I would encourage people to pay attention to this technique. And so that's kind of my list. I think I started off with those because they're kind of fit in my wheelhouse, but I think they're also something that a lot of people in our audience would get some value out of.
Thank you, Fairfield. We really appreciate that. Dr. Gaughan, unfortunately, was unable to join us for this recording. As you know, these technical service veterinarians get very busy trying to assist the veterinarians in the field. So I believe that Dr. Barnett is going to give Dr. Gaughan's picks. So Dr. Barnett?
And Dr. Bain, that was a good list. Your thoughts on those topics you're going to attend were really good. So thank you for that. And I'll do my best at trying to fill Dr. Gaughan's shoes, which is a tough task. But he gave me a list of some of the talks that he's interested in. So I'll try to kind of highlight some of those for Dr. Gaughan in his absence. Unfortunately, he's unable to join us today. So his first one was sports medicine, diseases with surgical options. And this is a live presentation, I believe. Dr. Gaughan states as a surgeon, this talk caught his eye. It's always interesting to hear how injuries and anatomical problems can be managed through carefully considered surgical manipulations. So spoken like a true surgeon there. I'm hoping Dr. Gaughan said he's hoping that speakers will also offer some new insights into traditionally challenging problems for athletic horses. So that sounds like an interesting presentation, one that Dr. Gaughan's expressed a keen interest in. His second one is, this one didn't surprise me at all from Dr. Gaughan, is Why Vets Leave Practice, Amy Grice. This is an on-demand session. And as many of you know, Dr. Gaughan spent a great deal of his professional career in academia and also helping new graduates early professional careers. So I think he has a interest and a concern about why vets leave practice. His comments were that we have had quite a few conversations in recent years about how difficult it has become to identify and retain veterinarians in equine practice. He believes much of this originates from new graduates finding they are not prepared with the skills needed to be successful in practice. So the frustrations can be significant and immediate. And adding to this, the hours that are required to do the job, the physical demands on the work, and relatively low pay does not make a positive formulation for success. So it's going to be good to hear what the speakers will offer as potential solutions. And as Dr. Gahn says, we need to find some answers because the horse still colics at 2 a.m., which is a very true statement. His third talk was biologicals. I think this is biological therapies. This is a table topic. Dr. Gahn states this has been an area of great interest in the last decade or more. The symptom and disease modifying agents appear to hold a lot of promise for injured horses and even some with developmental orthopedic disease. However, it has been interesting to observe that the FDA has not seemed to want it to become involved in the line of this line of therapeutics, which can lead veterinarians to sort out the many claims that have been made. So this talk will likely be a good review of the current state of the art of biologic therapies and hopefully offer a guide to treatment selection for appropriate cases. That should be an interesting table topic. The next one is also another table topic that Dr. Gahn selected, was pain management. And I believe, Kim, as you know, Dr. Gahn is, obviously as a surgeon and practitioner, he's been involved with a lot of pain management in equine and the horse. And I believe, didn't he do a podcast with you just last week on pain management, Kim?
Yes, he did. And it appeared, you can go back, it was episode 41, acute versus chronic pain management in horses. It was very interesting. You can go back and do that on Disease du Jour.
Yeah, thank you, Kim. I thought that was the case. So obviously Dr. Gahn's got an interest in pain management, and he's spoken on that subject a lot, and so he's going to attend this session. Managing pain in horses often requires a multimodal approach. Hopefully this talk will review the various agents available to produce analgesia for the horses. It would also be helpful to hear the rationales applied when selecting the methods available to treat horses in pain. I think that's a very good comment, to see what rationale the folks that give this table talk, what rationales they apply when selecting the different methods for analgesia. And Dr. Gahn's last one, novel approach to tendon healing, another table topic. The speakers for this talk are known for their creativity and dedication to finding new approaches for well-known challenging tissues like tendons. We've been doing a lot of different things in recent years, many with early impressions of success that may not stand the test of time. So this talk will very likely offer some new and encouraging possibilities and insights to speed and improve tendon healing. And Dr. Gahn's thinking this talk will build on the earlier one on the biologic therapies. So those two may have a link there as far as putting the information from those two table topics together to come away with some very practical and useful information for the practitioners. So those are the topics, Kim, that Dr. Gahn's, the top 5 anyway, that he's interested in attending. And those are his thoughts that I shared very briefly there for that.
Well, I really appreciate that, and I'm sorry he couldn't join us live, but I really understand and enjoy the table topics myself, so I can understand why he picked several of those. So now we're going to go to Dr. Bryant Craig. What are your top picks at the AAEP Virtual Convention, and why? Today's Disease du Jour podcast is brought to you by Merck Animal Health, the makers of prestige vaccines, Banamine, Panacure, Regimate, Protozil, and other trusted equine health solutions. Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as their ongoing investment in our industry, profession, and community at mercanimalhealthusa.com.
Well, thanks, Kim, for having us on to do this. And first off, I want to say, the virtual is going to be a new experience for all of us. And in some ways, I'm looking forward to it because many times I pick out talks that I want to go see. And get wrapped up in other business, standing on the convention floor and end up missing them. So with this format, I'm hopeful to be able to see all the topics that I've got marked and get a lot out of this AAEP. And by virtue of having them all on demand, that should be entirely possible. So kind of looking forward to that new angle to it, even though I'm going to miss seeing all my friends and people in the industry. This will add a little bit more accessibility for me anyway. So the first one that I have picked out to pay close attention to is the significance of radiographic findings in racehorses, led by Dr. Sue Stover. And, you know, this is something that I encountered a lot in practice and pre-sale radiographs, where you look at the films and sometimes you just have to go on your own intuition or your own experience, kind of anecdotally. And it's always nice to to have a kind of measured approach to these kind of things, to lean on and to support what you're thinking. So excited to see what comes about when I get to watch that lecture. The second one, How to Feed the Overweight Performance Horse, by Megan Shepard. And, you know, as we have improved the lives of older horses and we've improved nutrition of horses and kind of changed how they're raised, we see a lot more overweight horses out there. And I would say overweight is a much more common problem than the underweight horse anymore when you get into that performance arena. So just learning some tips and tricks to pass on to customers and clients and friends is going to be a big help. I know I've got a couple at home that fit in this category, so interested to learn the latest and greatest there. The third one, use of interleukin-6 as a biomarker for ascending placentitis by Dr. Fedorka. And this one's near and dear to my heart, having managed giant groups of broodmares while I was in practice. You know, you go through them this time of year and you're doing your ultrasound scans and measuring placental thickness and trying to decide if that fluid looks right or that placenta maybe is a little bit off. And it would be nice to have some sort of biomarker to either give you an earlier indication or maybe cement those feelings you have when you're looking at that ultrasound or doing that exam. So interested to see what that brings as far as an ability for us to diagnose an ascending placentitis earlier and more definitively, and maybe avoid some unneeded use of antibiotics or employ antibiotics a little bit quicker in the case where they're needed. So that one is of high interest to me. The fourth one that I want to pay attention to is association of mRNA biomarkers with catastrophic racing injuries in thoroughbreds by Alan Page. And again, you know, anything we can do to give us an earlier indication of a disease process is going to help us with diagnosis and treatment. So if we can find a biomarker that's you know, easily obtainable and easily processed, is going to help in that terrible outcome of racing injuries that we're faced with sometimes. So hopefully that has some promise and something we can put into place to prevent those types of injuries coming in the future. And then the last one, assisted reproductive techniques table topic by Dr. Hendricks and Hatzel. Just excited to see what may be forthcoming, what advances have been made in the last few years as we become closer and closer to commercial viability of a lot of these techniques, with oocyte aspiration occurring in lots of different clinics around, coupled with the ICSI procedure, and then just the advances we've made, you know, with embryo vitrification, different types of frozen semen extenders and usage, and then coupling all those things together. You know, it's become a kind of a new frontier in equine reproduction, and just get excited to see what's coming next.
Well, that's great. Thank you very much, Dr. Craig. And I'm going to keep you on for just a second because I know Dr. Chappell had a commitment come up. And so I wondered if you would just cover his list that he really wanted to attend and point out for other folks.
You bet. I'll try to do Dr. Chappell justice here on his list. And the first one he's got is a table talk, managing the mare with the abnormal estrus cycle, led by Dr. McHugh and Linton. And, I think this is something that anybody that's managed mares has come to be faced with, especially early in the year. Those abnormal estrus cycles can be a headache for all of us. So that'll be an interesting one to hear the talk banner around on how people manage those and what strategies they may use to combat those abnormal cycles. The next one he's got written down is the pre-purchase exam, ethical dilemmas and best practices, led by Dr. Morgan. Again, anybody that's been in practice for any length of time has probably included a pre-purchase exam with maybe the seller is your client, or you've got a conflict of interest with the buyer and the seller. Maybe we've got an injury that you found that nobody was aware of, and it becomes an uncomfortable situation, but we're faced with revealing it to both parties. So lots of different things can happen in that pre-purchase exam that puts us square in the middle of an ethical dilemma. So again, hearing other practitioners' thoughts and proper practices there will be a big help to everybody. The third one he's got is How to Support Immune Function by Lori Warren. And this is one, as we've gotten into the age of horses being transported cross country, up and down the coasts as they chase summer and the show seasons, and we've got racehorses transported all over the world. Immune function is a big subject. And as we do get all those mixings of populations, inevitably infectious disease can become an issue. So anything we can do to support immune function is going to be important. So that's going to be interesting to learn new ways to possibly help the horse in that process. The fourth one he's got is titled Inflammatory Biomarkers in the Low Volume Lavage of Mares with Endometritis. So again, that kind of goes along with the interleukin-6 talk that I am interested in. Any biomarker that we can find to help us diagnose and more quickly and efficiently treat infections in the mare is going to be a big help as we try to avoid antibiotic use as much as possible, but be able to judiciously use it when needed. So something like this will be of great help, as those endometritis cases can be very tricky, and a lot of times we don't get a great indication of what's going on there. So any biomarker that is viable is going to be a welcome addition to our arsenal. And then the fifth one he's got is How to Employ the 4 Principles Approach for Resolving Ethical Dilemmas in Equine Practice. And again, so that one's on demand by Barb Crabb. And, we in equine practice are often faced with those ethical dilemmas. So being able to have kind of a didactic approach to it and a way to think through that framework is going to be helpful to any practitioner out there as they battle the everyday dilemma of just being in medical practice, veterinary practice, and equine practice in specific.
Well, great. Thank you very much, Dr. Bryant. I really appreciate that. Now we're going to go to Dr. Christie Schneider. So what are your top picks to attend and at the virtual convention, and how come?
Hi, Kim. Hi, everybody. Thanks for this opportunity to talk about AAEP. I'm getting excited, as I think a lot of people are too. I'm also, as Dr. Craig said, disappointed I won't be able to see the people that I'm always excited to see at AAEP, but I agree, we'll have access to these lectures for quite a while after, and then also hopefully can attend some live stuff too. So the lectures and table topics that I picked, kind of a variety of topics, but the first one is diagnosing the neurologic horse in the field. And that's a table topic that's going to be facilitated by Dr. Amy Johnson and Dr. Steve Reed. And, as a general practitioner, being faced with neurologic horse, the possibilities seem endless. And I think guidance, as far as what's going on. And so any guidance that we can get as far as, sorting through those differentials, especially when a lot of those differentials have tricky diagnostic tests that come along with them, like Lyme disease, CVSM or wobblers, and EPM. And then when you add in, the potential risk of rabies with any neurologic horse, that kind of adds to the tricky situation. So, learning how others are handling these challenges and having the opportunity to ask questions in the table topic setting, I think will be great. Then the next one that I'm really looking forward to is the Milne Lecture. I always look forward to the Milne Lecture every year. And, the speakers are always, of course, at the top of their field, and really just a great time for them to showcase kind of, what they've experienced in their careers, which is always great to listen to as somebody kind of still, I think I would say I'm on the earlier side of my career. And so that's always exciting. And this year is no different. Dr. John Hubble is giving the Milne Lecture this year. And he was one of my teachers at Ohio State, both as a vet student and during my residency there. And so I know he has a wealth of knowledge to share. And he always has really great stories to go along with that are really fun to listen to. So I think he'll do a great job. And then the third presentation I'm looking forward to is the ophthalmology table topic. In practice, I've really focused on equine ophthalmology. I enjoy it. There's always something new coming up on the horizon, it seems like. And I think the table topic, this is going to be led by Dr. Leslie Easterwood and Dr. Carol Clark. And so I'm sure they'll have some great insights to share, but also, since it's a table topic, a great way to get your questions answered and to get tips thrown out by other practitioners that are dealing with these problems in the field and kind of what they like and how they approach their eye cases. And then the fourth topic I chose that I'm looking forward to watching is mentoring new grads and introducing them into a practice. And I think kind of going along the lines of Dr. Gaughan's, lecture, Why Vets Are Leaving Practice, I think let's focus on, or I think it's a good idea to focus on the early years in an equine practitioner's career. And I think that's really a critical time that we can make a big difference in their comfort in practice, their success in practice, and their longevity in equine practice, which of course we all want to support. So I really think that mentoring new grads should be a focus, ideally, for our whole equine veterinary community, and hopefully make equine practice a field that our colleagues want to stay in for the long haul. And then the last one is part of the Back to Basics, the acute abdomen in the field. This will be on demand. And I know Dr. Bain mentioned a few other topics within this kind of umbrella of managing the acute abdomen. And so specifically the one about how to manage a horse with colic in the field. And that'll be given by Dr. Blickslager. And I think whether you're a new grad or whether you've been treating colicky horses for decades in the field, I think that we and our equine patients can definitely benefit from thinking outside the box, learning some new ideas, thinking about different ways you can approach things, and it just gives you more tools in your toolbox. So I think that'll be a really practical and accessible lecture for everybody.
Well, that's great. Well, thank you very much. We really appreciate that, Dr. Schneider. Dr. Barnett, what are your picks and why this year?
Well, Kim, actually, most of mine have already been covered by my great colleagues here that have given theirs, which was a great representation of a lot of the really good talks that are available. going to be available this year through AAEP. And I would echo what Bryant and Christie said about the virtual meeting. It's a new thing for us, but I think one advantage it's going to provide to me, like Bryant said, is just going to be able to see those sessions that sometimes I plan to go to, and then I get sidetracked or stumbled up and don't get a chance to go see them. So a lot of these, they're going to be available, I believe, into June. Isn't that right, Kim? A lot of them will be available where you can still see those.
Here, that's right, to the end of June.
Yeah, yeah. So the only one that wasn't covered that I have a strong, keen interest in is it's actually an AAEP virtual showcase. Though these were formerly called the Sunrise sessions. This one that I'm really interested in is a presentation by Dr. Nicola Persterla entitled "Practical Tips for the Diagnosis and Prevention of EPM." That one is live on Sunday, the 6th at 2 p.m. Eastern Time. But I do believe that after the live presentation, it's going to be recorded and it will be able to be viewed on demand. Dr. Persterla is a really well-known equine infectious disease expert, and he's not only seen a lot of clinical cases of EPM in the field at the university, but he's also done a lot of research on EPM, and he's published a lot on EPM. So he should, he's obviously credentialed and in a position to be able to provide us a lot of information with regards to EPM, which I think continues to present challenges to horse owners and practitioners. And the serial prevalence across the U.S. is still quite high. Practitioners still see a lot of EPM cases, and I think and it seems like that all the EPM presentations are generally well attended, which attests to the interest level that it still maintains to the general practitioner. So I'm anxious to hear what tips Dr. Persterla is going to be sharing with regards to diagnosis and prevention of EPM. So I think he'll be sharing some new thoughts and new tips, so I'm anxious to hear that. And I think that wraps up mine.
Yeah, and I always love hearing him talk because he's got such great research-based comments to share with veterinarians in the field. So I want to make sure and not miss that one. So are there any final thoughts or comments that you would like to add?
No, just I would encourage listeners if they have any questions for us for any of the equine professional services team or the Merck Animal Health equine team, please don't hesitate to reach out to us. You can through either the Merck Animal Health website or also just a direct line to our equine professional services team if you have a question or an inquiry, or we can help you in any way. That number is 866-349-3497. And, we're just looking forward to. So if you have any questions or there's anything we can help you with, don't hesitate to give us a call. Any of us would be happy to help you in any way we can. And a little side note, Kim, if you don't mind me mentioning, when I was listening to Christie talk about mentoring new grads and introducing them into practice, there's a lot of veterinarians out there in the field that have sometimes an interest in going into industry, and those of us who are in industry, Merck Animal Health as well as the other companies, those of us in industry are always more than happy to share our thoughts regarding what we do as veterinarians in industry. So I just encourage people that if you ever have questions or interested or want to know about practice within industry, we're always more than happy to visit with you about that as well.
Well,
with that, I'll be quiet. Thank you, Kim.
Thank you for that, Dr. Barnett. And I want to let our listeners know that I will, in the article on equimanagement.com for this particular podcast, I will list all of these topics out with the speakers and so forth, so they will be very easy to find. And as we were going through these, so you won't miss any of them. But again, we want to make sure that you come back and listen to the podcast again on December 31st, and we'll kind of say, hey, what were the takeaways from this and some of the talks. So we appreciate all our listeners joining us today for this episode of Disease du Jour. And a very special thanks to our 20 and 2021 sponsor, Merck Animal Health. We invite you to visit equimanagement.com's latest Disease Du Jour podcast article pages and take our Disease Du Jour survey so we know how to better serve you with the podcast. If you have any questions or suggestions, you can also send me an email to kbrown@aimmedia.com. The Disease Du Jour podcast is a production of the Equine Podcast Network, an entity of the Equine Network.